I'm Dr. Charles Kwame Asiedu, a reconstructive plastic and burn surgeon and a smile train partner.
Let's start with the basics. Could you explain what pediatric burns are and how common they are?
So burns is injury to the skin caused by a variety of agents. In children, commonly caused by hot water. But other causes of burns include electricity, radiation, chemicals, etc. Children are particularly vulnerable to burns in the house when they are neglected or when there is improper supervision. Then these children tend to sustain burns, and commonly they sustain burns from hot fluids. And these hot fluids in the setting of a kitchen, hot fluids which are reachable, which are in receptacles, which are reachable to the children, and they knock it over. And sometimes also they sustain burns from their clothing catching fire, especially in traditional settings where they use coal pot and other traditional ways of fire open, where then they are exposed to open flames and their clothing tend to catch fire, resulting in deep burns. Burns in children tend to have a high mortality rate because of their peculiar anatomy and physiology. And also in our sub-region, burns in children are very fatal. Burns in general are quite fatal, high mortality rate. In the extremes of age, they tend to be more deadly. So children less than 1 year tend to have a higher mortality rate with the burns. The management of the burn patient tends to be multidisciplinary, requires different specialties. The burn surgeon, the pediatrician, the dietitian, the physiotherapist, the psychologist, because the burns affect all these specialties. Then with the main management will be the serial dressing, where the child goes into the bath, the wound is washed, and some topical antimicrobial agents are applied. And this is done every 2 or 3 days till the burn heals. And if after 3 weeks the burn doesn't heal, then the child will need surgery to cover the raw areas, what we call skin grafting. So skin will be harvested from elsewhere and to cover the raw area. Management of burns tends to be very expensive. It tends to be very expensive because they tend to have prolonged admission. That's when you have a major burn. Sometimes the children can stay on the wards for about 2 to 3 months. Then once, if you manage to survive, that is not the end. Then we go into the rehabilitation phase where we manage or treat or correct these deformities which result. Because the mortality tends to be high, especially in low and middle income countries. The mortality from burns is high, and it's because the management tends to be very expensive. So it is very important that we prevent these burns from occurring. And in children, it has been found out that most of the children get burnt because of neglect and inappropriate supervision. The accidental injuries in children tend to happen because of neglect in their caregiving and inadequate supervision. So it's important that whenever we are leaving our children at home, we tend to have areas where they shouldn't go, especially the kitchen. As much as possible, the children shouldn't go into the kitchen. And also hot fluids, which is the commonest cause of burns, shouldn't be reachable, shouldn't be within reach of the children. Where there are open flames, the children should also be prevented from going close. In terms of first aid, whenever you get burned, you need to get away from the source of the burn. And if the clothing is on fire, we need to quickly remove the clothing. Or if the child is old enough, he should be made to know that when his clothing catches fire, he should drop and roll. That will stop the burning process. Then after that, the burnt part should be exposed to normal tap water to cool it. And this will help reduce the extent and the depth of the burns. You shouldn't apply anything to the wound. We need to just cover it with a clean cloth and bring the patient to hospital. We should avoid applying cow dung, eggs, etc. to the wound because these tend to contaminate the burn. My main message concerning burns in children to the general public would be that, one, we should prevent these burns from happening. The children should be properly supervised to prevent them from getting burned. And once the burns occur, we should come to hospital in time to seek the appropriate treatment. And we are also calling on people who can help support children with burns, because as I said, management tends to be quite expensive, and it is usually people of low socioeconomic stature whose children tend to sustain these burns, and therefore cannot afford, usually are unable to afford the management. Their funds get depleted along the course of the management, and therefore will need financial support. So we want to also call on policymakers to possibly add the management of burns to the insurance. Currently, the insurance doesn't cover, only pays something small for the burns. So policymakers should also be encouraged. Advocacy have to be made so that in the policy changes, burns can be fully placed under insurance so that these children can benefit. Thank you.